A Norwood Park hospital is getting inundated with phone calls and emails urging doctors to treat a COVID patient with a medicine that's designed for horses.
WGN's Gaynor Hall has that story.
The controversy over ivermectin has been swirling across the country. The drug has not been approved or authorized for treating COVID-19 in humans or animals. With a barrage of phone calls and emails, followers of the conspiracy group QAnon have been demanding Amita Resurrection Medical Center treat a fellow supporter who's hospitalized with COVID-19 with ivermectin. Animal formulations of the drug are approved to treat parasites in livestock, and ivermectin tablets at specific doses are used to treat parasitic worms in humans. But outside of clinical trials, federal regulators, the American Medical Association, and the maker of the drug all agree people should not take the medication to fight COVID-19. During a Facebook Q&A yesterday, Chicago's top doctor echoed their concerns.
First and foremost, do not ever, please, take any medicine that is formulated for animals. It's dangerous and it can really be a problem. So, there are some trials that are going on looking at ivermectin, just as there have been trials of a lot of other medications. We don't have any evidence at this point, certainly, that it does anything to prevent COVID, just to be really clear about that.
Across the country, some people have sued hospitals to get ivermectin treatment. And after a judge ordered Edward Elmhurst Hospital to allow a patient to receive the medication, her family posted online that she improved. A spokesperson for Amita says the health and safety of patients is their first priority. In an emailed statement saying, quote, "Our physicians and clinicians follow the full guidance of the FDA and CDC in the treatment of COVID-19. And while Resurrection Medical Center has received hundreds of phone calls and emails associated with one patient's care, we have simply and respectfully noted the concerns shared."
I am a little surprised, I guess, that there are people who want to take a veterinary medicine that is not FDA approved, but then, don't want to take the vaccine that has had, really widespread human trials and is approved.
The CDC says nationwide poison control centers have seen a sharp uptick in the number of calls related to ivermectin use. Reporting tonight from Norwood Park, Gaynor Hall, WGN News.